seen at ESMO the results of the BEBYP trial, which is a randomized phase 2 trial in second-line metastatic colorectal cancer, addressing the question of the use in second line of Bevacizumab in combination with chemotherapy after including Bevacizumab in the first line. The primary endpoint of this study was progression-free survival, and this study met its primary endpoint. It was interesting because this was the second study of this kind, the first being TML, a randomized phase 3 study with primary endpoint overall survival. What has to be noticed is that the BEBYP study was interrupted early because of the results of the TML study. Anyway, the primary endpoint was met with a 35% reduction in the risk of progression if Bevacizumab was added to chemotherapy in second line after using Bevacizumab in first line. And this is very similar to the 30% reduction that was seen in the TML study. More interestingly, from my point of view, is the fact that the patients included in the BEBYP study was less selected than in the TML study. The TML study was really selecting patients who were responders to Bevacizumab. The inclusion criteria in the BEBYP study are much larger. People could have progressed during first line. There was no time limit interval. So it's closer to the daily practice. We don't have the overall survival of the BEBYP study because it is still immature, and anyway the study was not powered to show a survival difference. What we are missing at the most in those studies, as in any studies with anti-angiogenic agent, is a predictive marker of efficacy. Both studies have looked at KRAS, and from the point of view of progression-free survival, the KRAS mutational status does not matter. In the TML study, where the overall survival is available, it's essentially the wild-type, non-mutated KRAS patient who benefit significantly in terms of overall survival. However, Bevacizumab is not the only agent available. We have aflibercept that has been approved in second line with FOLFIRI with a significant benefit. So this is another candidate that could substitute for Bevacizumab in second line. We also, in the patient with wild-type KRAS, can use anti-EGFR monoclonal antibodies in the first line, and we could still use Bevacizumab in second line based on an older US study. So the strategy has to be defined according to the KRAS wild type, of course, the patient preference also in terms of toxicity, because the toxicities of the anti-EGFR and the anti-angiogenic agents are quite different. But overall, we should be able, with this combination, to improve overall survival in this patient. And more importantly, in the BEBYP study, as in the TML study, the use of Bevacizumab in second line is not adding toxicity to the chemotherapy regimen significantly. Therefore, it's not impairing the quality of life of those patients.